Michigan has the dubious distinction of leading the nation in COVID cases. What is happening and what's ahead with winter on the horizon? And as President Biden comes to Detroit to tout electric vehicles, a thorny problem awaits, and once again, it's China. Today is Sunday, November 21st, 2021, and this is Flashpoint. Hi, welcome to Flashpoint. It was another big news week, but right off the top, as we count our blessings this week, let's give thanks for the return of Michigan journalist Danny Fenster. Just as we were trying to absorb the agony of an 11-year prison sentence for an outrageous set of charges, he was suddenly on his way home after some very nifty work by the former U.S. ambassador to the UN, Bill Richardson. And seeing Danny back with his family was a wonderful and warm moment for the Army that had been advocating for his release. Danny, we are so glad you're back. And just in time for what is always a big week in the Motor City, Thanksgiving coming up on Thursday, and with it, the return of one of the city's greatest traditions, America's Thanksgiving Parade. We're back to the real thing, not a virtual edition. But the backdrop is the very worrisome rise of COVID cases again in Michigan. Here we are leading the nation in new cases. What's going on? Well, I've got 3 doctors on call to talk about it. And a little later, it was a big week for the city and for General Motors as President Biden basically christened GM's new Factory Zero plant. He couldn't have been a better pitchman for the new electric Hummer, but a recent New York Times op-ed warns of electric trouble coming from China. We'll talk about that too today on Flashpoint. All right, we're going to spend a good part of this morning talking about the COVID surge in Michigan that has been confounding to many. Our hospitals are again filling up. Somehow we've hit a pandemic high on the metric of the 7-day tracking average of cases. Let's talk about it with 3 men who are living this on the front lines every single day. Dr. Adam Mankara at the bottom of your screen, Chief Clinical Officer of Henry Ford Health System. Above him and to the right, Dr. Christopher Carpenter is the Chair of Internal Medicine for the Beaumont Health System, and our Dr. Frank McGeorge, our health and medical reporter here at Local 4, and also, of course, an emergency room physician with Henry Ford Hospital. Dr. Mankara, let me start with you. Michigan has seemed to move to the beat of its own drummer through so much of this pandemic. We haven't always been in lockstep with our neighbors or even the rest of the country. Why do you suppose we are now leading the country in cases of COVID again?
Unfortunately, we are seeing a 4th surge that we were hoping that we will never see. And I think there are a number of factors contributing to this. First, the fact that we have a variant at the present time, the Delta variant, that is much more infective and transmissible than we have seen with prior variants. Second, that we have kids back in school. And we know that the number of infections and outbreaks in school have been rising in Michigan, especially that people are indoors. Third, we are seeing at the present time people getting fatigued and lowering their guards. All of us have been out in public and we see people are not wearing masks, are not social distancing. And third, unfortunately, we've not hit the target threshold that gets us to herd immunity with vaccination. We are hoping for 70, 80% and are in the mid-50s in Michigan. So I think all of these are contributing to what we are seeing.
Those all seem very plausible as part of what's going on here. Let me move to you, Dr. Carpenter, but I'm not sure any of those are Michigan specific. Any idea why it's here?
Yeah, I think the factors that Dr. Mankara discussed are important because what they do is allow the spread of the virus. And us letting down our guard, I think, is a very important part of that. But what people need to understand is also the virus doesn't spread nationally; it spreads locally in our communities. So you get a little pocket in a group, and then that pocket can kind of spread out. So it kind of ebbs and flows throughout different communities, and that's what we're seeing right now. We had a good lull kind of towards the mid-late summer, and then as we kind of got together again in schools and other factors that led to that, and then just a few cases become many more cases. And until we kind of recognize that there are things we can do to mitigate this, we'll see this. And the vaccine is a very important part of this, but it is not a perfect solution.
No, it's not. It's certainly still the best one that we have, Dr. McGeorge, and we still need people getting vaccines now. In fact, you this past week urging people to be getting their boosters. But these most recent hospitalization numbers, we see that almost 30% of the people being hospitalized had the vaccine, and I thought that might not help some of the vaccine hesitant to get on board. So can you characterize the people who are getting the vaccine and yet ending up in the hospital?
Yeah, sure. I think that's a really important point. A lot of the people that are ending up in the hospital, even when they are vaccinated, are frankly older people or people with other immune compromised conditions. And in fact, if you look at the death rate among breakthrough cases, it is highest among people that are in the older age group, over 65 in general.
Yeah.
So I think, the underlying factors that put you at high risk for severe COVID are the same, whether you're vaccinated or unvaccinated. Being vaccinated gives you that much more of an edge, though, over being unvaccinated. And so whether you're high risk or not, being vaccinated puts you at a distinct advantage. And that's really why the vaccine is so important right now, regardless of what your underlying risk factors are. But certainly if you have, anything, whether it's age, obesity, hypertension, you name it, you need to get vaccinated because you are at extraordinarily high risk with these high rates of community transmission that we're experiencing right now.
It remains a big problem for people who are unhealthy to begin with, that's for sure. But Dr. Mankara, the breakthrough cases that we're seeing, would you ascribe those more to the Delta variant and maybe the way that it can work its way around our vaccines, or is this telling us more about how long the vaccines last and why the boosters are so important?
Well, I think it's a combination of both. As you have mentioned, 70% of the people who are hospitalized at the present time have not been vaccinated. So we know that vaccine play a significant role in that. The people who are vaccinated and getting the infection, that, like Dr. McGeorge has mentioned, are people who have underlying illnesses, whose immune system is compromised, and this is why they are not getting all the benefits of the vaccine. And there is no question that the data at the present time is clear with respect to the waning off of the effect of the vaccine, especially in the elderly population. What we have seen is that the immune system, the immune defense that's built with the vaccine goes down with time, and this is more prominent in people who are elderly or people who have certain conditions where their immune system is not as strong.
Yeah. Dr. Carpenter, we have seen reticence on the part of the governor and the state. Now, of course, she's also had some roadblocks thrown down in front of her by the courts, but we've seen some reticence to kind of move us back to some of the measures that we were taking early on. And I think some people, like a lot of physicians, argued that a lot of those were effective, and that's how we brought things under control to begin with. Is it time for us to move back to whether it's masking, a vaccine mandate? Is it time to move back to stricter rules?
I think we could ratchet it up a little bit. I'd be very cautious going back to where we were because we saw a lot of consequences from that were definitely unintended, and unfortunately we learned from that. But more community use of preventive measures would be really welcome at this time. I think I've been to some venues where people are just acting like there is no COVID, and those are the type of venues that we will see spread out of. It's challenging to kind of get them kind of to recognize that, and to, again, the simplest thing we can do is wear masks and wash our hands, and people are not generally doing that out in the communities unless the industry, the businesses and other areas are helping them to understand the importance of that. So I think if we could take that step back a little bit and kind of have that masking and other things out there, I think that would help a fair amount.
I think there is such a natural urge to return to some kind of normalcy, and Frank, that includes 4 days hence, when a lot of people will be gathering around their Thanksgiving table. We've got a lot of travel going on, a lot of family will be getting together with people outside their direct households. What's your worry level now, as we're already at this very high level, and now we move into the holidays?
Well, I think, one of the things that you highlighted was that Michigan is on a different curve than the rest of the nation.
Yeah.
So depending on how the mixes go, it could actually spread further across other parts of the country than just right now. In Michigan, Minnesota, for example, is also very hot. But, within Michigan, we are at such a high level of community transmission that even for families that do not live together but are still in the state of Michigan, you should still take appropriate precautions. And that might mean, doing an at-home test prior to a family gathering with multiple families or outside family members. There is a significant level of concern that the holidays, as they have done in the past, can increase the rate of acceleration. And we are already on an accelerated path right now.
Yeah. All right, we're going to take a quick break from our medical school lesson here. We come back, I'm going to ask the doctors about the biggest misconceptions that they're still having to deal with every day. Don't go away. This is Flashpoint on Local 4.
many SUVs, a Volkswagen can save you money on maintenance. Isn't that illuminating? Now's the time to sign then drive. Hurry in during the Volkswagen Sign Then Drive event and lease a new 2022 Tiguan for 0 down, 0 deposit, 0 first month's payment, and 0 due at signing.
This year, more than any other, are you certain you have the right Medicare plan? HAP is here, helping you navigate Medicare. Offering Medicare plans with $0 monthly premiums, $0 primary care visits, and $0 on most preventative vaccines. Dental, vision, and hearing coverage, and 24/7 telehealth. Face the future with confidence. Call now. See how HAP is here for you.
This holiday season, the Capuchin Soup Kitchen needs your help. For more than 90 years, inspired by the example of St. Francis of Assisi, the Capuchin Soup Kitchen has been privileged to serve people facing challenging circumstances. Today, the Capuchin Soup Kitchen has evolved to include programs like On the Rise Bakery, providing job training and a fresh start. We can't do this work without your help. Be a friend to the Capuchin Soup Kitchen by pledging your support today.
Compared to many SUVs, a Volkswagen can save you money on maintenance. Isn't that illuminating? Now's the time to sign then drive. Hurry in during the Volkswagen Sign Then Drive event and lease an all-new 2022 Taos for 0 down, 0 deposit, 0 first month's payment, and 0 due at signing.
4 tests.
4 tests.
4 tests
4 tests.
for women over 40.
So if you're over 40,
Make an appointment already.
you heard us. There are 4 critical tests for women over the age of 40 that could save lives.
Go to the doctor. Don't hesitate. And even if your doctor tell you that there's nothing wrong, oh, you don't need this.
Find out the 4 critical tests that you should be scheduling right now, Monday morning at 6:45 on Local 4 News Today.
Welcome back as we continue our conversation with 3 physicians about where we stand right now on COVID. As busy as we are in the newsroom right now, tamping out misinformation and disinformation on a daily basis, I know the 3 of you have been frustrated by the continual flow of maybe misconceptions. Maybe some of it isn't mis or disinformation, but just misunderstandings of the way things work. Dr. Mankara, let me start with you. What's your biggest frustration of something that you keep hearing time and again?
Honestly, it continues to be the disinformation that is being spread about the vaccines, whether it is related to their safety, efficacy, or the lack of data related to the vaccine. And the politicization, honestly, of that topic. If you look at it, when we combated smallpox or polio, I bet we did not sit down there and kind of question what the science is telling us. And we all came together to fight diseases that are ravaging our society and community. If you look what COVID has done at the present time, we have vaccines that have been tested among not only tens of thousands, but now hundreds of thousands of people.
Yeah.
We know they are safe, we know they are effective, and yet people are going around and spreading misinformation about these.
It's been very sad that we have not somehow been able to create more unity of purpose, that's for sure. Dr. Carpenter, how about you? The misconception that keeps nagging at you right now?
Yeah, I would say, along with the vaccine misconception, would be the belief by many in the community that it's not as serious as it is. That, you know, if I get it, I won't be that sick. And that's sadly pervasive in certain areas. And what I'm challenged with is, you know, getting them to recognize and understand that it is very impactful. And yes, most people who get it don't die from it. We know that, but a lot of people do. Most children do well with the infection, but a lot of children actually do run into problems with it. And what people don't recognize is it's about protecting yourself, but it's also protecting other people in your lives. And so you could be potentially putting people at risk coming home with COVID, and you've got a grandmother or somebody who's got a low immune system for one reason or another, and putting them at risk. But for people to really understand, and I think the media has helped us with this, is to get the word out that yes, people get sick with this, and people who are otherwise healthy get sick with this, end up in the ICU, the intensive care unit in the hospital, and get into trouble. And people die who you would just not believe die from it. We do have kind of a growing little, spread of influenza, which is similar because people don't believe you can get that sick from influenza. You definitely can.
Yeah. Dr. McGeorge, I'm afraid we at Local 4 kind of throw you to the sharks every day on this matter because we keep soliciting questions, and you get not only questions, but you get a lot of comments and a lot of claims. Tell me about the ones that are vexing you the most right now.
Well, you know, I hear so many basically off-the-wall allegations that I think, you know, some of them aren't really even worth addressing because it just brings them into the fore. But, you know, one thing that in addition to what Drs. Carpenter and Mankara have already talked about is that I think people are under the misunderstanding that there isn't something that they can do about it that would make a big difference. And by that, I mean personal responsibility with regard to distancing, masking, simple social behaviors, hand washing, et cetera. I mean, those things can make a huge difference. We saw, you know, very clearly influenza dropped off the map last year because we were taking precautions. I'm not saying that we need to roll things back to the way they were before, but with the current spike that we are seeing, going back to simple, even masking in public with the rate of high transmission that we're seeing is well worth doing. It does decrease the spread. And I think that's something that has been unfortunately, you know, politicized in the past. And people just need to get over it and accept the fact that it does do something. And if anything, it's just a courtesy in society right now.
Yeah, absolutely right. Dr. Mankara, Pfizer right now is asking for emergency approval of its COVID treatment pill, not a preventative, but a treatment. If this works as well as they believe it might, how does that change our calculation and our path forward?
I think it adds to the list of treatments that will help us fight this disease. I don't think it replaces the vaccine, which is preventive, but it will help us hopefully keep people out of the hospital. One of our biggest issues now across the state and across the nation, in fact, but now in Michigan, is that our hospitals are filled with patients who have COVID and patients who do not have COVID. We have staff who are on leave because they have tested for COVID. So we want to make sure to get to a point where we are able to free our healthcare system to take care of chronic diseases and illnesses and acute problems that patients have and keep people out of the hospitals and protected from severe COVID infections.
Dr. Carpenter, that's another misconception perhaps that people have, and that is the drain that this is putting on the rest of our system. We originally had it as a drain because people weren't going for their routine checkups on things, which was causing long-term problems, but now other people needing hospital space, right?
That's true. I do want to add something to the previous comment.
Sure.
There's actually a Merck antiviral that is actually going to be in front of the FDA in a couple of weeks. So that will hopefully be available to us. And what it'll do is help us pivot, because we're trying to use the monoclonal antibodies and try and prevent people from getting sicker. This and the Pfizer antiviral will potentially or hopefully help us pivot to an oral agent that is much easier to take and administer, and then reduce the impact on the hospitals. Going on the hospitals themselves, we struggle. Henry Ford is struggling. U of M is struggling. Everybody is struggling with this because you have right now, 10, 15, 20% of your hospital is with patients with COVID. So you are not able to take care of patients who otherwise would be getting care as well as you would like to. So we are strained, and we also have, as everyone is well aware, a shortage of healthcare workers that is really impacting the way we can care for folks. We're able to do it, but it's really a strain.
Oh, there we go. Dr. McGeorge, I've only got about 20 seconds left. It would be nice to have a cure, but there's an old saying about an ounce of prevention, right?
Yeah, absolutely. I mean, the vaccine is really, the answer, and mitigation strategies, distancing, masking, hand washing, those things work. And I think we need to stick to the tried and true things, preventing illness before we get to the point of treating it. But it's good that treatments are progressing. I will have to give it that.
Gentlemen, it's been a very terrific conversation. Thanks so much for the time, and have a happy Thanksgiving. We continue. We'll talk with trouble ahead for electrification in America. This is Flashpoint on Local 4.
A goal line QB sneak, a pick six, even a flea flicker bomb. No matter how they put points on the board, you win. Because you can bet $1 to win 100 if either team scores a point during a college football game. If it sounds like a great offer, it's because it is. Download the DraftKings Sportsbook app, enter the promo code, bet $1 to win 100 if a point is scored, and Nate, it's raining.
Delta Dental is investing $5 million in a collaboration with the Detroit Riverfront Conservancy to build what will be one of the most exquisite playgrounds in the country. The Delta Dental Play Garden will open on the West Riverfront in the near future. It will include an enormous bear slide, a toddler park, an amphitheater, and other features designed by Detroit school children. You can get a glimpse of this exciting public space by checking out the all-new Delta Dental float during America's Thanksgiving Parade.
Forgotten Harvest is a lifesaver for a mother like myself with children and having so many snacks and lunches to make.
The food from Forgotten Harvest make me feel better in school.
Because these children around this community really look for Forgotten Harvest. And I thank Forgotten Harvest for helping me and my family out. Forgotten Harvest needs your support to help families in need.
We need your help today.
Before you put that turkey in the oven,
I hear like crash. A bunch of glass broke.
You've got to see this.
I heard the loud boom, and I hear my husband say, the oven just exploded.
How's this even possible?
Holy cow, this thing's
a lot of glass.
There's a lot of glass.
Help Me Hank investigates what's causing this dangerous phenomena, and it's more common than you might think.
3 or 4 people said it had happened to them.
What to watch for so this doesn't happen in your home.
Join me for this very important consumer alert, Danger in the Kitchen, Monday, starting at 5.
We have spent a lot of time on the program on the move to electric vehicles. The stakes could hardly be higher for the Detroit automakers. There are big EV initiatives tucked into the infrastructure bill, and yet the road ahead seems even bumpier than we might imagine. And some of those bumps are well articulated in a recent piece in the New York Times written by Steve Levine, editor of The Electric. And Steve is good enough to join us here on Flashpoint today. Steve, the title of your piece is America Isn't Ready for the Electric Vehicle Revolution, which sums up big trouble, doesn't it?
Yeah, I think so. There's a strategic space that the United States, that both the government and also industry, and I'm really pointing the finger at industry because it's its job, hasn't paid attention to while China has.
In fact, China, we know that China was way out ahead of us on a lot of getting a lot of electric car makers and really trying to get everybody to be first adopters of this technology. But what you're talking about is a more insidious problem. Even if we could get everybody to catch up on their enthusiasm for the electric car, it's the minerals, the lithium, the cobalt, all of the stuff that we absolutely have to build electric cars, which takes us right back to this massive supply chain problem that we've already now become too acquainted with.
Right. So everyone understands what's happened with chips and also everything we're ordering. It's taking so long to get things. That is a microcosm of what we're facing with the battery problem. So both of us, the United States and China, began at the same time creating electric cars in the aughts. About a dozen years ago, Elon Musk did and GM did. Right. Then we stopped, and then we resumed about 2 or 3 years ago. China kept going, and what it did was it locked in supplies of cobalt, manganese, nickel, lithium from around the world, and is getting all that shipped to China. And then it established the chain of factories that process all of that. Is a very complicated and difficult thing into the final battery grade materials that go into the cells, into the battery cells. That's what we're missing. That's the most strategic piece.
So even when we're talking about building new, it's almost as if everybody thinks we're going to learn our lesson here. We're going to build our own battery plants here. If all the material you need to go into those batteries comes from elsewhere, you haven't really moved the problem very much.
Yes, and it's not just that it's coming from elsewhere. It's coming from a single point, and that's China. And so we are in a technological rivalry with China. And so basically we're asking our main technological rival to support our race against it. And so this is a real problem. And the way it is, we basically put ourselves in a losing position for the whole of the 2020s, because that's how long it takes, about 10 years to get the whole thing put together. If we start now, we can get ourselves positioned for the next decade.
Well, in fact, Steve, we have watched over the years, we've watched, I always liken it to a roulette table as the automakers have tried to figure out what the next power technology was going to be. There's still some people that want to talk about hydrogen, on and on and on. Right now, we have come to the place where it's lithium that's so important to a car battery. Are there other technologies out there that are possible or likely that might help us get around this current supply issue and move us to another kind of technology? Anything you've seen?
Well, it's not a different technology. It's a different formulation of lithium ion. Really, we are going to be, just like silicon was and is going to be the future of chips, computer chips, lithium really is going to be the basis of batteries for EVs. But there's a formulation that doesn't include nickel, does not include cobalt. There's a acronym for it. It's LFP, and a lot of people are talking about it. It's cheap iron. It's made of iron. Iron is everywhere, but we've got to set up the factories here to produce it. Right now, China produces virtually all of it for the entire planet. I'm not hearing anyone making plans to build LFP capacity here in the United States.
These are warning bells that we need to hear. There's no doubt about it, because I think the whole world has decided this is where the technology is headed, and there's going to be winners and losers. Steve Levine is the editor of The Electric. Really good to have you on the program. Thanks so much for taking us through all that.
Thanks for having me.
You bet, Steve.